This is the story of American suicide. The message is neither pro-gun nor anti-gun. It's pro-prevention. We need to adopt mental health conscious gun policies that can still preserve individual rights and stop stigma. Why? Because suicide and guns are inextricably linked, and radical anti-gun policy simply isn't going to happen. Now, when most of us hear gun violence, we think of mass shootings like Columbine or San Bernardino. We might think of homicide and aggravated assault. Some of us might even consider police shootings, gang violence, and drug disputes. But the reality is that 2/3 of all U.S. gun deaths are suicides, a total that comes to a staggering 21,058 deaths per year, or one gun suicide every 25 minutes. To further put that number in context, imagine these dots represent all the gun deaths each year in the U.S. This indiscernible sea of dots is the number of deaths from gun-assisted suicide. Of course, it's logical to then ask if this is really a gun issue or a mental health issue. The answer is a little bit of both. Suicide attempts made with guns are more likely to be fatal than those with any other method. Only 6% of suicide attempts, but over half of all fatal suicides involve a gun, meaning that guns play a huge role in the fatality rate. At this point, it's often assumed that I'm going to advocate for banning all guns, everywhere and from everyone. But I argue that there are moderate, feasible solutions that still support individual ownership rights. That's because we have different places we can intervene. Primary prevention involves stopping a disease or condition before it could ever occur. This would be the ban guns approach. Secondary prevention is intervening with those at highest risk, and tertiary is minimizing consequences like extra training for first responders and friends or family. One secondary prevention approach that I advocate for is the novel firearm choice law. Firearm choice laws refer to an individual's ability to voluntarily register on a do not sell list. Persons who believe they may be a threat to themselves in the future can act preemptively to ensure their own safety, and in so doing, have additional personal agency without affecting others' ownership rights. If they change their minds, they can be removed from the list after a 7-day wait and psychological evaluation. So what should we take away? A big part of gun violence is suicide, so our solutions need to address this. Gun legislation does not mean taking away or banning all guns. It's about balancing ownership rights with safety of users. There are gun suicide prevention mechanisms that don't require safe, responsible gun owners to give up their firearms. But we still need to change something about gun ownership. Mental health is only one part of our suicide problem.